So classic allergy symptoms are itchy, watery eyes, itchy, runny nose, sneezing, nasal congestion, postnasal drip. With a flu or a virus, you can have a low-grade fever, you may have muscle aches, you can have nasal congestion, stuffy nose, sore throat. But with COVID-19, you're going to have a fever, cough, shortness of breath, difficulty breathing, and possibly diarrhea. Allergies don't cause those symptoms. That's number one. Number two, you're going to recognize with allergies you've experienced these symptoms in the past. It's very different from COVID, which is, of course, all of a sudden type of symptoms. And number three, with allergies, you might find that your symptoms improve if you go indoors and you decrease your exposure to the outdoor allergens, which may be your triggers. So from the literature that is out published to date, there's nothing in the literature to suggest that COVID-19 affects people with either allergies or asthma differently. The patients with asthma are not at an increased risk of infection with virus or increased risk of severity for an asthma attack with COVID-19. So right now, the recommendations are to continue with your antihistamines. I know there's been some literature, some concerns about some literature coming out from Europe. We don't have anything to substantiate that. There's no concerns that we are able to identify at this time regarding stopping nasal sprays or saline irrigation. The recommendations are to continue to use your nasal sprays, wipe them down, wipe the nozzle down after you use it. Obviously, do not share your nasal sprays with anybody else in the household. Continue to do the nasal saline irrigation and follow the recommendations per the manufacturer for sterilization. So for asthmatic patients, it's important that most important is for you to, if you've not received an influenza vaccination, make sure you receive an influenza vaccination. Number two, continue your asthma medications. Do not stop your asthma medications. There's been some concern about whether steroids increase the likelihood of either contracting the virus or spreading the virus, and there's no literature to substantiate that. So please continue to take your medications as prescribed. Number three, of course, maintain social distance. If you are sick or you have concerns that you may have the contracted COVID-19, please contact your provider. So I think that the top tips would be, number one, for asthmatics, there's no increased risk of COVID-19, as best as we know, as best as the literature tells us right now. Number two, continue to take your inhalers as prescribed. For patients with allergies, if you have regular itchy eyes, itchy nose, sneezing, that suggests allergies. Continue your nasal sprays, continue to wipe down the nozzle, take your antihistamines as prescribed. If you do develop symptoms of fevers, coughing, shortness of breath, and or diarrhea, then of course seek care and see whether your provider thinks you need to be tested for COVID. But those are signs that are different than those from regular allergy symptoms.